Hello, everyone. My name is Catherine Houghton, and I'm so glad you're able to join today's webinar, Why is My Dog's Health Care Better Than Mine? Learning from Veterinarians to Improve Human Health. So today it will be both myself and Dr. Suzanne Turan from Mars Petcare who will be presenting on this topic. And just wanted to give a little bit of background about who MadPow is and who the Center of Health Experience Design is. So MadPow is a design agency, and we leverage strategic design and the psychology of motivation to create innovative experiences and compelling digital solutions that are good for people and good for business. The Center for Health Experience Design, which is part of MadPow, is a community of over 800 professionals and a range of organizations in the health space. Our partners include fledgling startups and global corporations. So we really focus on collaboration, which is why I'm co-presenting this today with Dr. Turan from Mars Petcare. So we really like to piece together and govern multi-stakeholder initiatives that are open to and benefit the greater community. We also have a membership model as well as a project model. If you want to learn more about the center, just visit our website at centerhxd.com to learn more. And I just wanted to give a shout out that we have our Health Experience Design Conference coming up in Boston on April 14th and 15th of this year. Our registration is now open, and you can learn more at hxdconf.com. And it is a great annual conference we've been doing 10 years that really talks about up-leveling the health experience for, primarily humans. So we're using GoToWebinar for this webinar. And what we're planning to do is present for about 45 minutes, and then we're going to spend 10 to 15 minutes answering your questions. If anything arises during the course of the webinar or something occurs to you, just enter it in the question box and we'll get to it at the end. And I will also be sending out the recording of this webinar and the slides probably later this afternoon, tomorrow morning, with our emails attached. So if you have any questions, feel free to reply to that, and you can feel free to forward the slides and recordings to any of your colleagues that might be interested. So just a little introduction here is that why are we even talking about animal health? So it comes up to the fact is, like I said, it's not the Center for Human Health Experience Design. And for me personally, I have always worked at both the human and the animal health intersection. So when I lived in California, I used to work at the Kaiser Permanente Garfield Innovation Center, where we worked on innovations to help improve the patient and member experience for Kaiser Permanente. And at the same time, I was volunteering at the Oakland Zoo, where I was working with a bunch of animals. So every week I was in there helping to care for these animals. A few years ago, I moved back to Massachusetts, and every weekend now, I am at the Cape Wildlife Center or Mass Audubon helping with animals. So just an aside, so the Oakland Zoo animals I used to work with were a rainforest string of animals. So I had sun bears, terrapins, siamang apes, etc. So very much in the care space. But now that I'm working at Cape Wildlife, it's very much a surgical hospital in which we bring in injured and orphaned wildlife, bring them up from infancy if they need to be, do surgery. I don't. But it's really much more of a hospital. So as I've been running the Center for Health Experience Design and doing this weekly animal care for animals that are in a hospital situation, I've been really thinking a lot about the intersection of human health care and pet health care. And earlier last year, I met Dr. Turan at an event, and they were talking about the work they were doing in digital health for pets at Mars Petcare. And I personally found it really fascinating, and I thought it was something that you as a community might be interested in. So let me hand it over to Susie, who will give you an introduction as to what is happening at Mars Petcare.
Well, first, I'd like to thank Catherine and MadPow for this opportunity to speak to all of you about the work that we're doing around innovation in vet care, pet care, and how we might partner with you in the human healthcare space. and also thank all of you who have joined. Catherine and I have some very interesting comparisons to share, and we really look forward to some lively discussion in the Q&A section at the end. To get started, since I believe most of you work in human healthcare, though I think there might be a couple of vet people out there, I thought it might be good to get started with a little background about the pet vet space in general. So here's some information that I've taken from a survey done by the American Pet Products Association, showing that about 2/3 of households have some kind of pet. So that's approximately 85 million pet-owning households in this country. And most of these own a dog or a cat, as you can see, or they own multiples of these, with around 63 million dog owners and close to 43 million cat owners. Some other points of note that aren't shown on this data, but I thought might be interesting to you guys, is that the data does skew slightly younger than the general population, and also skews very white, particularly in cat owners. Now, whether this is because of who's taking these surveys as opposed to who owns pets, we don't quite know. But those were two facts I wanted to kind of throw out there for some of the future conversation. If we look a little more closely at pet ownership and generational differences, we can see that there is an underrepresentation of the less traditional pets in the baby boomer and builder generations. So things like fish, birds, what I call the small furries, which are hamsters, rats, mice, gerbils, etc., as well as reptiles, are much more commonly kept as pets the younger the generation. And then in the, the reason I'm showing you the generational stuff is that in our vet pet space, we do look a lot at generational trends in pet ownership, as at the end of the day, it's the pet owner that determines the type and level of engagement with healthcare and other pet services that the pet gets. No dog or cat or any other of these animals ever walks into a vet clinic with a credit card, despite how much a vet might wish that they would. So we have a large focus on the millennial generation, as I'm sure everybody on this call does, particularly now as they start getting more disposable income. So what do people spend their money on healthcare-wise? This data here shows that this data doesn't show it by generation, but it does start giving us a sense of where pet owners where their focus lies in the pet health space. So if you look at this data, you'll see clear evidence for one big area of disparity in pet health, namely that dogs get much more care than cats do. Dogs visit more frequently than cats, 2.5 times per year on average versus 2 times per year. Dogs get more services than cats in every single category in the middle section, except for emergency services. And that is not a big surprise because we see that, when cats do actually finally make it into the vet, it's usually because they're in dire straits and they really need the care. So that's probably why emergency vet visits show a bigger spend for cats than for dogs. So therefore, one clear area of focus for those of us working in the pet health space is how we get cats more care. After all, it really isn't that cats are more hardy than dogs. Rather, they're better at hiding disease. So this might lead even the best cat owner to think that they don't need care when they actually do. Cats are also way better than dogs at opting out of visiting the vet. They hide from their owners. They express their vehement displeasure at being caught and put in a pet carrier. And sometimes, even once they get to the vet, they make it so hard to do a good physical exam that they get more rushed care than dogs do. Another interesting fact that I put on here, which is to the right of your screen, is how pet owners prioritize their own large medical expenses in comparison to how they prioritize them for their dog or cat. And you can see that there's almost an even split, at least for dogs, between a prioritization of medical expenses. So people care deeply about their pets, with almost a third of both dog and cat owners placing their pets' needs before their own. And then finally, a note on health insurance. Catherine will speak a little more to this in her section, but at this point, what I wanted to point out was how few pet owners actually have pet insurance in this country. You can see 15% of dog owners and only 8% of cat owners are actually engaging in health insurance. If you compare this to Europe, pet insurance has been gaining traction since the early to mid 2000s. And even back in 2017, market penetration was around 25% in the UK and an astounding 40% in Norway. And this growth in Europe has just continued since that time. The good news for insurance companies here in the US is that, as you can see from the data here, the younger generations are embracing insurance at higher levels. So the younger they get, the more they're engaging in health insurance. So we will definitely see growth in this area. However, with this 15 and 8% for dogs and cats today, you can see that insurance is an area of veterinary care that contrasts sharply with human health care. Vet care is still very much paid out of disposable income, and so it's likely that this drives or at least impacts some of the key differences that you'll see between human healthcare and vet healthcare, which Catherine will speak to later. Okay, so I framed the landscape in the pet care industry. Now I'll talk just a little bit about Mars's role within that industry. Likely most of you have heard of Mars, but think of it as a candy company, right? So it brings us such wonderful things as M&Ms, Snickers, and Starburst. However, the largest segment of Mars is actually their pet segment. It all started with pet nutrition for them, with brands such as Pedigree and Sheba, but Mars Pet Care also has one of the largest specialty food brands in Royal Canin, as you can see from the brands in the right of your screen there. And then if we move away from food, we have what I refer to as pet products in the bottom. This started with the Wisdom Panel, which is a canine genetic test backed by the world's largest breed database, and also the ability to screen for more than 150 genetic health conditions at this point. The next frontier for Mars was the Whistle Activity and Health Monitor, which is somewhat like a dog Fitbit with integrated GPS ability, and I'll talk a little bit more about Whistle down the line. And finally, in the upper left, you'll see the area of vet service. This is in both general and specialty care. And there are around 2,000 veterinary clinics or hospitals in the US and over 400 in Europe. So this really does make Mars Pet Care the largest provider of veterinary healthcare in the world. Nutrition, health, and products all focus towards one central purpose, which we're all working towards, which is to make a better world for pets. More recently, a new division within Mars Pet Care has taken root, and this is Kinship, which is kind of the formalized innovation arm within Mars Pet Care. So this division seeks to spearhead transformational change within the pet industry. And there are three key areas where Kinship works. So first, it's through incubation of startups in the pet space. So these are companies that are outside of Mars Pet Care that Kinship will invest in and also mentor as they work through, the joys and woes of being a startup. Secondly, by harnessing and repurposing the millions of records of data that we have at this point that are being collected over the years in all of the different brands, both nutrition brands as well as the vet service brands. And then finally, by identifying gaps in care, service, and products, and then building up those businesses for a more comprehensive delivery of networked care within the pet space. And it is within Kinship that you will find the team that I work on. As Catherine said, our team name is Digital Health, so that's a little bit of a misnomer, as we do a lot more than just build apps, which is what people tend to think whenever we say digital health. So we are one of several labs around the globe whose focus is really identifying pain points that are being faced either by pet owners and by extension their pets in getting care for their pets, or by the veterinary teams who are trying to provide that very care. We then design and microtest potential solutions to those pain points. And for us, a microtest could be one hospital, for example. And our test can include something very small, like a very targeted service or a very targeted product, or it could be something as large as a new business model. And once we've identified those pain points, one of the things we do is actually look at the human healthcare sector. So we try to identify similarities and differences and see how you might have tried to solve something or had been successful solving something. To give one concrete example, though the models are different, we do look quite a bit at pediatrics. It's kind of the closest model to what we do, with a patient who has little or no voice and an advocate or proxy who's in charge of their care. Obviously, we don't have to contend with HIPAA, so that can loosen the reins somewhat on what we can do. However, we do have something called the veterinary client-patient relationship, affectionately known to all in the industry as the VCPR, and that places different constraints on us than HIPAA. And though the rules around VCPR vary state by state, they do tend to impose some interesting restrictions on the practice of veterinary medicine. Take, for example, the blooming world of healthcare. In our world, there are severe restrictions on what a veterinarian can do over the phone or via some other virtual means. In most states, only general advice can be given, and a vet has to actually physically see a pet and perform a physical exam in order to diagnose, prescribe, or treat the pet. Some states do allow telehealth as a follow-up to a specific condition for which the pet was physically seen in the recent past, but other than that, it's pretty restrictive. So our team at present has 3 areas of focus, which I've labeled here as kind of 3 pillars. We have what we call asset light, which is service models that require less upfront investment or a smaller footprint than the traditional brick and mortar clinics and hospitals that we own. So think things like mobile vets or express pop-up locations, for example. Our second pillar is consumer diagnostics, and this includes finding or creating and then testing diagnostics that can either be used by the pet owner at home or that can improve what is currently available in a clinic. So all of this is with the goal of decreasing the stress and burden for the pet and the pet owner in finding the reason for the alteration in the pet's health. And even better, some of the stuff that we're working on is early detection to avoid clinical disease altogether. So we have some products that we've been looking at that, for example, allow you to monitor a cat's urine, and I'll also speak about Whistle in this realm as well. And then finally, we have the area of virtual services, which is kind of our foray into tackling the issue of telehealth in the pet space. To highlight a few of our active projects, first in the realm of asset light, we do have a mobile veterinary unit. As you can see from the problem statement, this really started with the thought that seniors living in retirement communities who have pets might desperately want vet care, but really not be able to guarantee getting it once they move into a community setting. And so they might be stuck relying on their adult children to get the care for their pets, for example. And the research that we did showed that seniors were giving up their pets when they moved, or were certainly not continuing pet ownership once the pet had passed after they'd moved into these communities. So we started a pilot in the greater Denver metro area, which was centered around accessibility to care, bringing the mountain to Muhammad, so to speak. And from our work, it became clear that there was a lot more than just vet care at play here. So I will come back to this particular problem in a few minutes. In the realm of consumer diagnostics, we are partnering with Whistle Health on a project called the Pet Insight Project. And this is a really ambitious project which is looking to leverage technology to shift our understanding of pet health. Ever since Whistle's inception, the plan was to use the data being generated by an accelerometer that's in the collar that you can attach to the pet's collar to really better understand pet behavior and more specifically see what could be uncovered regarding pets' health from their activity. So it's kind of making visible and unspoken, kind of giving the dog a voice, basically. So we've been, what has been done on this Pet Insight project is really pair the continuous monitoring that is provided by the Whistle device that a dog wears on their collar with Banfield Pet Hospital medical records to uncover links between some sort of action, so some movement on the accelerometer, and disease that shows up. So we then develop algorithms that analyze behavioral changes before, during, and after a vet visit. And that helps us identify patterns of behavior that have been signaling disease. And we can use these patterns to alert an owner of the change before they're actually even aware that their pet is sick. So at this point, we're still in the learning and training phase, but we are already able to discern when a pet is eating, when it's drinking. And in the first kind of medical stuff that we've done is when the pet is scratching and licking more than normal, comparing a pet against either itself or comparing it against pets that are similar to it, so breed and age and gender and so on. And the goal of this project is really to identify as many patterns of behavior as possible that can be linked to disease, and then provide the pet owner and the veterinarian with increased knowledge of what is affecting the pet, some early detection, and the ability to really make better decisions, informed care kind of earlier in the process. From a virtual care perspective, we are aiming to tackle the challenge being faced by pet owners in knowing what data or information to trust and how to make the best next decision regarding their pet's care. So when a pet displays some unusual sign today, there's no like Mayo Clinic curated content that pet owners can reliably turn to on the internet. All there is Dr. Google, basically. So Google search that, as we know, can display a wide variety of information which may or may not be valid and may or may not have a particular level of quality. So when you couple this with the challenge of engaging with a pet owner where they want to engage, we have kind of the inception of where this particular project comes from. Everyone loves to have lots of apps on their phone, but I think we're probably all reaching a point of app fatigue. Which app is best? How many specialized apps do I need for any particular need? So what we're doing is testing a virtual vet in your pocket by making it available actually through third-party relationships rather than a standalone app that somebody has to find and then download. So what we want to do is reach pets through relationships with third parties that they already have. So for example, picture yourself standing in a local grocery store, let's say a Safeway, and you have no clue what food to buy for your pet. Are you buying the right thing? Is there something better? Your pet's transitioning from being a puppy to an adult. What should you do now? With the service that we're looking to provide, you could go onto your Safeway app and find out, either by some sort of self-service feature or by actually speaking to a vet. So it's easy access to a vet curated content, and couple this with a kind of a 24-hour nurse line, which will allow the pet owner to make more informed decisions about seeking care in person. So it's really not about replacing vets in hospitals. It's about enhancing the experience and having the pet owner really make an informed decision about when they do need to see somebody in person. However, what we're finding is that to be truly revolutionary and transform pet care, we really need to come up with system solutions. So an example of this is kind of the challenge of pet obesity. According to a survey done by the Association of Pet Obesity Prevention in 2018, we had close to 60% of cats and over 55% of dogs who were being classified as overweight or obese. That equals an estimated 56 million cats and 50 million dogs in this category. And among the findings of this survey, they also found that both pet owners and veterinary professionals are confused by conflicting pet nutritional advice and continue to struggle to help pets achieve safe and ideal weights. So being a veterinary nutritionist, for example, requires a DVM, so the equivalent of an MD, so a veterinary degree, as well as a PhD. And there's actually only 94 registered veterinary nutritionists in the world. Compare that stat to 150 pet food companies just in the US and over 2,500 different food formulations. So this is brands and formulas. So really, it's no wonder that pet owners and vets are confused about what to do around nutrition. And when it comes to diagnosing pet obesity, what the survey found was that only 53% of pet owners are reporting that their veterinarian discussed their pet's weight during their annual visit. 19% said that this only happened occasionally. 20% said that the vet only discussed it when they were asked, and 8% said that they had never talked to their vet about nutrition or the pet's weight. So what's likely not a surprise to any of you is how intimately tied this weight issue is with what is being suffered in the human population, right? It's unlikely or impossible that we on the vet side will solve the issue of pet obesity without actually addressing the issues of weight management and healthy weight for pet owners too. So I can tell you as a vet that it's much harder to have a conversation with a pet owner about their pet's expanding belly when they are overweight themselves. And I can imagine it must be similar in the pediatric world. Therefore, the issue of pet obesity is one where we see a huge area for partnership between human and vet healthcare. And if obesity doesn't excite you, here's another area for opportunity. As I mentioned in the slide on our mobile veterinary unit, shortly after starting our care delivery to seniors, we realized that these owners were really lacking much more than veterinary services for their pets. They need grooming, they need dog walking, they need an easier way to get food for their pets. And furthermore, in the last couple of years, there's been clearer and clearer evidence of the true benefits of pet ownership for seniors, as well as for other at-risk populations, right? So seniors, along with millennials, are at very high risk for loneliness and isolation. So one of the things that we wonder is, can pets be an effective prescription to combat this, right? Can we prescribe a pet to a senior or to a millennial? So we know that seniors give up their pets when they move into care facilities. So one of the things that we're looking to do is, can we create a complete care package that will allow them to keep their pets, or even restart pet ownership for them, or maybe they've never been pet owners and they can do so, in the golden years of their life, and have a companion who is always there for them. And then once they have this, do we actually see true improvements in their health, be it physical, emotional, or mental, when they have this pet? So therefore, we're starting to partner with a variety of organizations to test this, and we see this as a potential win-win-win, right? Pets who need homes can get homes, helping with the shelter situation, and obviously helping the pets who are looking for, their forever home. Seniors can get companions who have been, selected for their particular needs, and can also be given a package of care that allows them to easily have the pet. And the care facilities can get to create a more welcoming space with, at the end of the day, a better quality of life for their residents. And maybe even insurers or human healthcare providers can see the benefits of improved health for the non-furry patients. So this all leads me to give just a little shout out to the One Health concept. Hopefully some of you have heard of this. Originally created back in 2006 by a couple of MDs and one veterinarian, it's expanded very slowly, gaining traction in just a few pockets, sometimes under different names. Some of you might have heard or read the book Zubiquity. And then I think most of the traction has really been gained under the comparative medicine or translational medicine banner. But as you can see from the graphic, even though it's a little bit of an eye chart, it's a very far-reaching area of health that encompasses public health, surveillance, human-animal bonds, health economics, and the environment, to name just a few. And at its core, what it really seeks to do is remove the barriers between disciplines that are currently stopping progress and creating unnecessary knowledge silos. And the end goal of this is to create a more effective and efficient holistic approach to health in the broadest sense, right? And just to put a couple of things up here, the efforts in the One Health space range from animal models of disease, which some of you are probably familiar with, be it, cardiac health, cancer research, et cetera, to public monitoring, a lot of zoonotic diseases out there, and surveillance, to social concerns. The bottom article here talks about, items that are affecting families, so both the furry and non-furry, things like violence in the home. Domestic violence has been seen to be very tied between pets and people. And most recently, Catherine and I were surprised by this, thinking, we made this particular webinar was going to be very timely, because back in December of last year, the U.S. Senate unanimously passed a bipartisan resolution to designate January 2020, so this current month, as the One Health Awareness Month. So exciting stuff. We're looking for more people to partner in this sense. And as I said, Catherine's now going to talk a little bit more about some provocations around human and healthcare. So hopefully we'll find some areas of partnership that benefit all patients, both the furry and the not so furry.
Thank you so much, Susie. That was really great. I found it really interesting again. So I'm really excited to hear about the work you're doing at Mars Petcare. So I just wanted to take this and go to thoughts that we had as I've been at the intersection of human healthcare and pet healthcare, and thoughts where we could, in standard design world, you do analogous industries to get inspiration. So I just pulled together a couple of things that exist in the vet world that I thought might be really great inspirations for projects or to be utilized in the human healthcare field. So first off, I want to talk a little bit about pet health insurance. Susie's already talked about how much it's starting to penetrate, and the millennials are really the ones picking up. And I want to just talk a little bit about it for those of you that aren't deeply familiar with pet health insurance. So full disclosure, I have pet health insurance for my cat, and I'm a Nationwide is the plan I have. It's not an endorsement, just a statement of fact. And I went onto the website to pull up a comparison about how would the nationwide plan compare to, say, the one offered by the ASPCA and the AKC. And you can see that it's very clear what it is. So you pay a base premium, which can cover emergency care. You can add wellness, so your annual exams can be included. You have deductibles and copays, just like human insurance. And what I really appreciate about it when you're going in to make selections, they really give you an understanding about how, if your, say, dog gets an ear infection, how much that might cost from a veterinarian and what the reimbursements might be. So you can kind of understand what the value of this plan would be, and understanding that is it worth this investment or not, since it is an optional thing as opposed to a lot of healthcare choices. And some of the things that are interesting about the health and how healthcare is how it's administered in the vet world. So the vet is not at all involved in the insurance. So unlike if you go to see your GP, there's a whole back office doing all this billing and coding that doesn't exist in the vet world at all. All that happens is that the patient gets care, and then the vet provides an invoice. And then the pet owner will submit that invoice to the insurance agency, and then the reimbursement is set directly to the pet owner. So there's a lot less overhead and bureaucracy involved in this. And there is one exception to this, is that Trupanion will actually pay the vet directly. It's just one-off plan that's slightly different. But the whole point is that you don't have the burden on the vet to worry about going and claiming money to get insurance. So it's all done independently. So it just makes the overhead of owning a vet office a lot lower than, say, a GP office. The also other thing about pet insurance, which is very clear, is that there's a very specific major medical plan benefit schedule. So this is the one I pulled out for my cat. It's 5 pages long. The pink area is zoomed over on the right, and it gives a very clear, like, here's the code, here's the diagnosis, here's much you'll be reimbursed if it's primary or secondary. So again, I have an understanding of what my coverage is. It's very clear. There's not a lot of room of confusion. I don't have to make a bunch of phone calls to my health insurance company to find out what would be covered or not covered if I brought my animal into the hospital. And one thing that I really love about getting a vet service is that they give you transparent pricing prior to treatment. So if you ever bring an animal in to, say, emergency care, like this example on the left, which I took off of Google Images, is that they would give you an estimated cost range. They said, this is what we anticipate the service to be, and this is what we think the ballpark price would be. So it could be $1,000 to $1,500. You say, is this acceptable? You sign it, and then they go and treat the animal. And at any point in time, if they realize there's additional services they need to do, they will call you and ask you for permission. So the upside of this is, like, even if you're paying out of pocket, you have an understanding of what your financial commitment is before you take any action, and you're able to decide what the treatment would be in order to minimize your out-of-pocket expenses. Obviously, this is very different from human health care, where you kind of go in there blind, you don't know what's going to happen, and you know you'll get random bills that may show in a month or 2 months after your treatment. So you have no idea how to account for costs, and just you kind of have to cross your fingers and hope for the best. So what's interesting also is that vet clinics are very good about listing their prices up front. So they have these low-cost clinics at, like, a lot of vet offices. You know, their vaccination. So here, if you need to get a microchip, it's $15. If you need to get a rabies shot, it's $7. Again, it makes it a lot more accessible to people because they understand what's going to happen if they bring their animal to a vet. They understand that I only need to have $20 on me. It's not this mysterious thing that you black box that is human health care. And what's interesting, if you guys seen this announcement a couple of months ago, that Walmart has opened up a health clinic in Dallas, Georgia. And if you look to the pricing on the right, it actually is kind of reminiscent of a vet clinic. And to be honest, I reached out to the people who did the design research for the Walnut Health Clinic to ask them if they actually looked at veterinary care as a model. And they said they didn't, but they did do 25,000 hours worth of research. And this was their outcome, was that people really want to understand how much things are going to cost before they actually commit to anything. And the other thing I find really great about the Walmart Health Clinic, similar to a vet clinic, they don't treat your teeth and your eyes as separate health conditions. So when you go to a vet clinic, the vet that does surgery to spay your animal will also clean the teeth. It's not a separate practice that has nothing to do. It's not a separate health insurance. It's all one thing. An animal is treated as a complete body as opposed to humans, which their eyes come to different doctors, their teeth come to different doctors, or even their audiology might be a different type of doctor. So the fact that Walmart is already kind of heading in this area is really exciting. And the other thing, I asked him about how usage was, and he said it's going so well. They said the usage of this health clinic is 3 times more than what they anticipated. So that's pretty exciting. And they also said that in a couple of clinics coming up in the future, they're going to be adding Petcare to it. So when they talk whole family, it's whole family. So don't know when that's coming out, but I find that pretty exciting. So the biggest outcome, I think, is really, I know a lot of people are looking at making healthcare more affordable, no surprise bills, but really if we look at the pet pricing model and the veterinary pricing, how might we make healthcare costs more transparent and predictable so that we can make smart choices and have that feeling of financial security as we deal with our healthcare crises? So that's one kind of provocative question I wanted to put out there. The other interesting thing about veterinary care that's very different from human health care is that a vet has a continuity of care from birth to end of life. So we all know that our pets sadly live a lot shorter lifespans than we do, and that the upside with that is that the vet may know your cat when you bring it in as a kitten back to the end of life, say hopefully 20 years later. So there's a relationship that is built that goes through the entire life cycle of this animal. Versus as a human, we're born, we see a pediatrician, and then at some point we may transfer over to an OBGYN, we might transfer over into an internal medicine specialist, and at the end of life we start dealing with the geriatricians. And each one of them knows us in a particular way at a part of our lives. And even though all this information is being captured in our electronic health record, and as we go through that, data is getting better at following us throughout our lives. But at the end of the day, it's just data. It's like, oh, this is what my weight's been doing over the past 50 years, or this is what my blood pressure is, or my A1C. It's not a story about who we are as a person. It doesn't let your new doctor know like what you've gone through in life. Like a dog, you'll know that they swallowed it. They have a tendency to eat socks, and they've had 2 surgeries to get them removed from their stomach. And you'll know that even there as an elderly dog, that this is what they were doing when they were a puppy. And it just builds that connection between the vet, the pet parent, and the pet. And my question to you is like, how might we create a stories for people that travel them with their whole lives, so that when they are in a nursing home potentially at their end of the life, that they're not just Mr. Smith in bed X. Right there, like, we know Mr. Smith, he grew up here, and this was his story, and he fought in World War II, and he became a state senator, and really building that connection so that A, it maintains the dignity of the patient as they go throughout their life, and B, hopefully brings that sense of connection to their patient and the provider and the family. And there is a field that's new, that's been coming out since the early 2000s called narrative medicine, that's already kind of using this whole storytelling to help build empathy and connection between patients and providers. So again, the thoughts I have on this one is like, how might we create a solution that helps people's stories travel with them their whole lives? As Susie already mentioned, they use the pediatric patient model as they develop solutions in vet care. And as you said, the reason for that is that the patient doesn't have a voice. So you have to depend on the adult in the room or the pet parent to actually manage the healthcare and champion the needs of this animal or child. And what's interesting is that in human healthcare, yes, we have advocates at the beginning. When we're a pediatric patient, we would have a parent or guardian with us up until the age of, say, 18. It might be 16 in some states about privacy. But there's an advocate there championing for you. And at the later part of our lives, you might have a health proxy signed and somebody on their health proxy. But there really isn't a system for having an advocate with you the entire life that's really giving you that independent, helping you champion, helping you fight your way through maybe health insurance, or helping you deal with the doctors, the processes, or making sure you're getting the right treatment. I mean, granted, you might have a spouse or a sibling or a friend that's helping you, but how might you ensure that every patient has an advocate? And what does an advocate mean actually in human healthcare? Like, different than a healthcare proxy, slightly different than a navigator, but somebody who's on your team, who's really championing for you, that is looking out for your best interests as you go throughout the healthcare journey. Another interesting thing about vet care is that this is particular to specialty vets like Blue Pearl, which is one of Mars Petcare's, or other specialty clinics, is that they offer on-site counseling for everyone. And what I mean is that when you're going into specialty care in a vet, your pet might have cancer, or might have other really urgent issues, is that the conversations that you have are very hard. And they're different than what you have in human healthcare. Obviously, euthanasia is a conversation you have in pet care that you don't have in human healthcare. There's also upside is that the price is a lot more visible, but then you also feel you might be in a position of having to making economic decisions, which are not easy. Like, you don't have $5,000, but you really love your dog. Like, it's really stressful for pet parents to make decisions under these circumstances. So a lot of vet specialty clinics will have an on-site counselor to help you work through your issues as you try to make care decisions in that really stressful and difficult environment. In a hospital, a human hospital, you might have a care worker that's associated to help the patients and the patient family really make care decisions and help you navigate nursing home. What do we do? But I find that there tends to be a gap of, what about the care team? What about the nurses and the doctors who are dealing in really stressful environments, dealing with both patient care, their lives, their interpersonal issues that may exist amongst the care team? What kind of counseling is available for them in the hospital setting to help improve their mental health, their stress levels, their work-life balance, and help them be better nurses, doctors, clinicians in the hospital? So a question I would pose is, like, how might we provide on-site counseling to the care team for the humans that are caring for humans in a hospital? Another thing that I find interesting is that second opinions are very straightforward when it comes to pet health. Again, if you have a really beloved pet that might have a complex condition, it's very easy to go get a second opinion. You can either get a friend might refer you to a different vet. Your vet might say, go check with Dr. Y, and it's very easy. And the healthcare part of it, the health insurance part of it, if you're dealing with health insurance, is much straightforward, right? It's you either pay out of pocket, or I just send the invoice to the consultation to the vet insurance company. But when it comes to human healthcare, it starts getting very complicated. It's like, okay, well, sure, you referred me to this doctor. That's great. Is that doctor within my network? Not within my network? What is that going to cost me? Will they pay for a second consultation at all, or is this going to have to be 100% out of pocket? Then you're starting to make all these conversations with the doctor's office, through your insurance office, everything, to make sure, again, that this is the right doctor and how much will this cost you. And if that doctor even decides to do surgery or whatever, is the places that he do surgery, is that out of network or in network? It becomes an incredibly complex conversation. So my question to you is, how might we reinvent the second opinion service to make it more efficient and transparent, just like how it is on the pet health side of things? And this is the last kind of idea I wanted to kind of throw at you as a concept for conversation. So as I said earlier, we all kind of know when we adopt a puppy or kitten or baby bunny that there's going to be a time when that pet is no longer part of our life. And whether it's just natural or euthanasia, there are decisions and conversations we have in pet life that we typically don't have in human healthcare. So in humans, if we get a diagnosis, we do pause and ask what's important, but we really struggle in humans with that whole quality of life versus quantity of life. And we tend to veer on the fact towards quantity. Let's extend their life. Let's do this additional treatment. We really humans resist our own death when imminent or a family member, and we really try to hang on. And there's a question of how much should we let our loved ones suffer if we don't really understand what the impact of treatment might be. So how to let somebody go peacefully is a very difficult conversation, and it's not really an easy one or one that's planned for in humans as it might be in pet care. So there are things like living wills which exist. First of all, they're not legally valid in every state. So just because you have one doesn't mean that people will pay attention to say what your desires might be. And they really tend to focus on more like, what kind of health care do you want delivered? So do you want to have a feeding tube? Would you want to have CPR? Would you want to have mechanical ventilation, right? And it's like, who knows what that feels like? I would never know how to say that, yes, I want this, not to know this. What are the implications? It's a strange conversation to be having, and we don't really have that in pet care. What we have in pet care is much more this conversation about quality of life. And there's this scale that was developed by Dr. Alice Villalobos called the Quality of Life Scale. And it's very clear about how to define what is the quality of life that a pet has experienced. Are they playing? Are they taking care of their coat? Are they cleaning up? Are they using their litter box? Are they eating? Are they sleeping more than usual? And it's a very clear scale, as I show here on the slide, about how to say, is this a good quality of life or is it not a good quality of life? But there's absolutely nothing equivalent in the human that says, what would quality of life mean to me, to my parents, to somebody else I'm responsible for taking care of? Like, how would you define your quality of life right now? What does that mean? And so the question I have is, like, how might we each define our quality of life to make decisions easier when the end is near? Like, what would a human version look like in this case? Just some interesting thoughts. So I just went off to a couple of inspirations about how vet care is done that could have inspiration or applications to human health care. And like I said, I went through a little bit on the whole price transparency and predictability, lifelong stories about letting your doctors know your whole person, how might we improve patient advocacy, provide on-site counseling for care teams, make the second opinion process easier, and how would we define quality of life. So we're kicking off into the question and answer discussion portion of this webinar. And just a few things I want to ask you is, like, did we miss anything? Is there anything about healthcare that you think that we should really look, that we should steal good ideas from vet care? What gets you the most excited between everything that I covered and what Susie covered? And hey, would you want to work together? Is there anything that you want to explore with us? So taking it from there, I'm going to see if you guys want to put questions into that area I suggested. So if you have any ideas, anything you'd like to ask, Susie and I will take up until 1 o'clock East Coast time. So we've got 11 minutes to get your feedback and thoughts and ideas about this topic. So just waiting to see if, again, just put it in the question. So Susie, did any ideas come to you after the first time we've actually run through this? So anything that I said may have provoked any new thoughts on your side as we wait for questions to come in?
Oh, well, there's so many things swirling. Yeah, I mean, from our point of view, I think, we touched on the topic of insurance and kind of how that has potentially driven so much, or shaped, I said rather than driven, shaped so much of what we see in human healthcare today. So I think from my end, as we see an uptick in insurance on our side, on the vet side, one of the things that I think of is how do we avoid some of the pitfalls, I'll call it, that human healthcare has experienced, with that shaping of the insurance industry on the human healthcare, and how do we learn from those, whatever the mistakes were, and really make the experience better. So, as I mentioned in the last thing when I was talking about seniors and packaged care and so on and so forth, one of the things I'm really passionate about is how do we bring together the worlds of human and vet healthcare in a way that is positive for both sides, right? Because I think solutions are easier when everyone gets a benefit, right? When nobody has to really give. And so I'm very excited about potentially being able to do that work and show the benefits for human healthcare and almost shift the cost of pet care to a different provider who is seeing a clear benefit, right? So like the nirvana for me and the hypothesis is, would human healthcare companies prefer to pay for a senior or somebody suffering from depression or a veteran who has PTSD? Would they prefer to pay for that person to have a pet than for them to be on, opioids or, or suffer heart attacks or diabetes, et cetera, right? Like, to me, that's the next frontier of this kind of interplay. And so that excites me. But with the caveat of, because insurers, I'm sure, will be involved, how do we avoid the pitfalls of then that shaping vet healthcare and human healthcare and maybe not shaping it in the right way?
Mm-hmm. No, that's a good point. Like, I love the idea of prescribing a dog to obese people to get them out and moving, or elderly to get them walking during the day. And like, as you said before, elderly dogs need to get moving too, and pairing up elderly dogs with elderly people so they're both walking at the same pace and helping each other live better, stronger lives. We do have one comment here, is that on-site counseling for veterinary care team, including vets, seems highly valuable. In the human health space, there is a lot of discussion and relative awareness about physician burnout, but there is less awareness around the high level of suicide among veterinarians.
Yeah, that's a great point. I mean, I think it's one of those topics that is starting to really gain some traction on the vet side. I think I saw a stat actually just this morning that 1 in 6 vets have considered suicide. So it is an area of we've surpassed, I think, it's dentists in considering suicide. So or in actual suicide rates. So yes, it's burnout is a big problem, and I mean, I can even, some personal experience. I ended up leaving clinical practice and now work, in innovation, and was lucky enough to be part of a company that would allow me to work in various different spaces. And I did that because of the challenge to quality of life. So yeah, I mean, there's, you spoke about care teams that is more common in specialty practice. I think the biggest burnout you see is in general practitioners because of the long hours and just the challenge of going, to your point of, it's great to have one vet be able to do from pediatrics to geriatrics. The challenge with that on the physician side, on the vet side, is that you do find a common day is to go from a puppy room where everybody's excited and there's a brand new puppy and everyone's happy and joyful, and your very next room is a euthanasia, right? And you have 30 seconds between those rooms, and then you do the euthanasia, and then your very next room is a puppy, right? So there's a lot of highs and lows, which I think lead to burnout. So yes, the challenge of addressing that burnout and that the quality of life, not just for the patient and the pet owner, but also the vet and the team, is a huge area of focus, I think, as we have going forward.
Thanks for that insight. Yeah, I can't imagine. And I know the vets I've worked with in like the zoos and the wildlife centers are very much like, this is it's a mental space that's much better to help, preserve a species and breed like endangered animals to help save a species, or, help, repair a owl's leg is a very different experience than dealing with companion animals. So again, love for animals, but yeah, a companion animal vet is a high stress job in general. So we've got 5 more minutes. So let me just take a couple of more slides. And still, if you have another question, I'll keep monitoring that. So again, I wanted to let you know again about the Health Experience Design Conference that's coming up in April. We'd love for you to come and check us out. We've been doing it for 10 years. We have workshops. We have some really interesting keynote speakers. So check out the website and hope you're able to join us. And then I want to thank you so much for taking the time to attend this webinar. I hope you found it inspirational and enlightening, and just kind of a cool new thing to learn about how animal and human health have so many things we can learn with each other in this whole One Health initiative. So if we'd love to work with anybody on the call, both Susie and I, Mars Petcare and or MadPow, so we can help you with your design and innovation goals. Here at MadPow, we do research and strategy. We do user experience design and development, service design, intervention design and evaluation, and design and innovation challenges. If you have any questions, you can reach out to me. There will be a survey that pops up when you log out of this webinar, so I'd really love it if you could fill that out. We do like to get feedback. And if you would be interested in working with Susie or MadPow, you can just put a note in there as well. And as I said, later today or tomorrow morning, I will be sending out the recording and the slides. So don't worry, those will be coming to your inbox shortly with both my and Susie's contact information. So I really appreciate your time and attention, and thank you so much for joining us today. Hope to see you at the next webinar.
Yes, thank you all very much. Thank you, Catherine.
Thanks, Susie.